Hi, my name is Patrick Oltmans. I'm a physical therapist here at Living Well Therapy. Today what I'd like to talk to you about is foot and ankle pain. I've been a physical therapist for 18 years. I've been working with people with foot and ankle pain for a long time. It's an area that I consider a specialty for myself. So let's talk about that a little bit. Somebody who's having foot and ankle pain, the first thing that's really important is we want to find out what is the source of your pain. A lot of different things can be happening in the foot and ankle. We want to do a diagnosis, an assessment, figure out, what is the source of your pain. There are several different common problems or common sources of pain in the foot. Some of those things can be plantar fasciitis, they can be or plantar fasciosis, it can be Achilles tendonitis or tendinosis. I see a lot of people who come in with issues with the arches in their foot. Sometimes people have low arches, sometimes people have high arches. I get a lot of questions about, what's an appropriate footwear, shoe, or even orthotic, for those different issues. And those are things that I can help you through. For these different foot injuries, commonly what we're doing for treatment is we have modalities at our disposal, meaning we have ultrasound. Occasionally we use electrical stimulation, ice, heat, those sorts of things. I consider myself a manual therapist, so what that means is I'm using my hands as a treatment modality. I'm stretching, I'm getting in there and working tendons with my hands to try to promote healing. We need to make sure that the joints in your foot are moving properly. Sometimes those are things that people can stretch on their own, and I can help people with stretches that you could do as part of a home program. Sometimes those things are things that it's difficult to stretch, or sometimes even impossible to stretch at home. You need somebody who can get in there and do what we call joint mobilization. So we're stretching a joint to help promote mobility in the foot. We're also prescribing therapeutic exercise or exercises for you as part of a home program so that you're stretching, so that you're doing strengthening exercises. One of the things that I frequently see is people are very weak in their feet, and a lot of times the medical industry is steering people towards orthotics and footwear to support your feet. And I think as a medical community what we're missing, and what I do, is I'm always working with people on the strength of their feet. It's interesting, if you take a baby and watch them try to learn how to use their hands, it's just a process they have to go through to figure out how their hands work. I look at the feet in a very similar way. We have musculature in our feet that we should be able to move our toes in different ways, and if you right now take your shoes off and try to move your feet around, 9 out of 10 times or even more, I find that people can't move their toes in more than very simple ways. By doing some exercises to move your toes and move your feet, we build up the musculature within your feet, and a lot of times we're trying to get you out of these shoes that are built to support your foot, or out of orthotics, because the musculature in your feet are what you need to ultimately support your foot and give you long-term healthy results with your feet. So what can you expect if you come to see us at Living Well Therapy for your foot and ankle pain? First of all, you can expect great results. We have really good results with our patients who suffer from these ailments. To put numbers to that, to prove that, we work with a company called Focus on Therapeutic Outcomes. They're a national company that studies therapists who participate in this program. They're sending them data about how many visits they spend with a patient and what kind of results did that patient have. And we participate in that, and I can assure you we have very good results.
One of the things that we really want you to know is that if you or your physician feel that you may benefit from physical therapy, you have the right to choose where you do your therapy. At Living Well Therapy, we are in network with nearly all insurance plans. We will get you started quickly, and we will take good care of you. We hope that you choose Living Well Therapy, and if you do, we think that you will be happy with your choice.
So if you're interested in coming in and getting some help with foot and ankle pain that you might be having, or if you know somebody who is, please give us a call. We'll bend over backwards to accommodate your schedule, get you in very quickly. If you're not sure if this might be right for you, or if you have some questions, please give us a call. I'd be happy to sit down. We offer a free 15-minute phone consultation. We'll work through this with you and see if this is appropriate for you. Thank you very much. We'd love to hear from you.